Good morning. Today is Saturday. It's our regular yoga therapy class. Okay, let me get a little bit of a sound check here. Hopefully, everything will be okay. Check, check, check. Sound check. Check. Okay, it's all good, and we are ready to start. Uh, Last weekend, I was out of town. Um, we were in, I was in Hampton Roads area. We had a program from the Zinnia Yoga Studio, and most of them are yoga teachers, yoga practitioners, healthcare providers, and again the question came up, how does yoga as a therapy works? What is the basic physiological understanding? From the Western medical perspective, it is the activation of the parasympathetic tone, activation of the relaxation response, which counteracts the sympathetic overdrive of our fight and flight response, which we call it a stress, and it is a excellent antidote to our lifestyle related disorder, which we also call the stress related disorders. From the yogic perspective, it is your meditation. So meditation, and it's a what we call meditation is medication, and it's also a global health, global healing. Like for all the chronic lifestyle related disorders, we talk about that the healing takes place initially, which we call a roger chikitsa, or we call a treatment of the disease. Then you call it shastarokha, or maintenance of health. This health maintenance keeps us healthy. And if you look at the origin of the words, like health comes from healing. If you don't have any healing, you don't have any health. Healing, health all comes from the root basic Latin word, is called heal. And a practice of yoga, which is a philosophy, which is called Yoga Sutra of Patanjali, which is about 196 small aphorisms or sutras, of which 193 is quieting down your mind. And you quiet down your mind, what happens? Mind is like a software, body is a hardware. So all the bugs in the software is gone, and basically practice of yoga is like your what do you call the software updates. You have a phone, you have a smartphone, you get the software updates, And basically, a practice of yoga is the software updates, taking care of your software, which is the mind, takes care of your body. So, body-mind connection. The practice is 8 limbs of yoga. It's a yama, social restraint, niyama, personal restraint. There are 5 social restraint, 5 personal restraint. Asana is external and internal alignment. It's a relaxation response. Remember one thing, you cannot get into these postures or asanas if you're tight. It's a relaxation which lets you to get into those asana poses. Pranayama, prana is your energy which cannot be measured, and our breath is a carrier of the prana. Pranayama, yama is a control and restraint. It's a voluntary regulated breathing. That is the most important of our yogic practice, because when lung is functioning properly, or lung is functioning better, your heart functions better. Lung and heart is the same organ. When heart is functioning better or well, the brain is functioning well, because it's a perfusion in the brain. When the brain is functioning well, most of the cellular functions are well. So able to improve your pulmonary function, you improve the function of your whole body. So pranayama is absolutely an important practice, and we do it every single day. We don't miss a pranayama practice. 5th limb is a pratyahara. Pratyahara is a reject. Har means intake. Basically, our intake is not through only food, intake is the 5 senses. We hear, we see, we smell, we taste and touch. And all the information which comes in, and these informations are controlled. Mind is the content of your 5 senses. Able to control your 5 senses is your controlling your mind. 6th sense is the dharan, it's a focus. When you start having a focus of your mind, in a short time, you get it defocused. Defocused is basically means your mind is in a state where it is not generating the repeated thought process, and the mind in a state, what you call a introspection. That means you start looking inside yourself and able to tap what we call the medicine cabinet of your mind. We get into the medicine cabinet in our bathrooms, or wherever in your home has a medicine cabinet, but in a state of yogic relaxation and parasympathetic activation. What you are accessing the medicine cabinet of your mind. Your body and your mind is able to produce every medication which you take from outside. Because remember, the medications you take, the medication works in our body, which are able to block an enzyme, able to enhance an enzyme, able to block a receptor, able to enhance a receptor, able to block certain factors like say tumor necrosing factor, TNF blockers are like a Humira, in the market, TNF blocker, or it's going to block your neurotransmitters. The main transmitters are those: dopamine, oxytocin, serotonin, endorphin. Either it blocks or enhances. Like for your depression, the medication for depression enhances your serotonin. But same thing does in a yoga practice. Yoga practice enhances the neurotransmitter. So the 7th limb is called your meditation. That's called dhyana. So remember one thing, the meditation is not separated from yoga. It's not a yoga and meditation. It could be yoga asana and meditation. Meditation is the 7th limb of yoga practice. And this meditation is medication. 8 limbs is your samadhi, which is a union of your body, mind and spirit. And when you're able to reach that level, you're obviously in a state of parasympathetic activation, and it's guaranteed that your longevity will be who knows what, 90 years, 100 years. Remember, when we had people who lived 90, 100 years, we put this health tracker, we put this is my Apple Watch. When you put this health tracker, first thing we see, the heart rate is 65 or less than 60s. The heart rate is not going high up, and also heart rate doesn't have a sudden rise. On the other hand, people who are not in a parasympathetic activation, even if their resting heart rate is 60, the moment they get up and take 2 steps, boom, it goes up to 90s. That means it's a deconditioned heart, Heart in condition in a place of stress, when we're walking, we're treadmilling, we're doing weight training, it is going to have a slow rise and a rapid fall. A deconditioned heart is a rapid rise and a slow fall. So that's what we call meditation is medication. Remember, the root word of your, say, root word to healing, root word of healing, mederi or physician, which is a medicus, mederi, medicus, and these are all connected to the same word, is your medication and meditation. And when you look at the spelling of it, meditation and medication, there's only one letter. Meditation has a T and medication has a C. T is for transformation. So if you do meditation, you transform yourself. You transform yourself from this sympathetic overdrive in a stressful situation to your parasympathetic activation. As simple as it is. So, the therapy for yoga practices is your meditation. So, meditation is a state. Like for your asana practice, you have to prepare the asana practice, prepare your body and breath, pranayama practice, so you will enter into a state of meditation. You really don't do a meditation, don't come and say, I'm sitting down, closing my eyes, I'm doing some chanting, I'm a meditation. No, your physical body is not ready. You started doing this thing when a state of meditation, and that breaks your thought cycle. What is a meditation? Meditation is you're controlling your thoughts. How does it control? Like normally we have thousands and thousands of thought process generating, and every thought process comes from our thinking. I'm thinking. Majority of our thought process is in the past. Another big number is in the future. Very few we have the present. Past is a history. Future is a mystery. Present is the time. That's what we call a present. But even in the present, most of our thought process are your repeat thought process. I have to come, I have to teach, I have to talk. It's a continuous called chattering of the mind. Chitta vritti. A practice of yoga is called a chitta vritti nirodha, controlling the chattering of your mind. So basically you enter in between your thought process, which is a gap. And slowly your gap gets bigger and bigger and bigger. So you still have all the thought process, but you don't have the repeat thought process. So your mind stays in a state of parasympathetic activation of what you call a supratentorial brain, which is our limbic system, amygdala and hippocampus. Amygdala responsible for your fear and hippocampus for your memory. So controlling your fear and fear of unknown is your stress. And the memory, when you control the memory, the thought process doesn't come to you. Oh, so beautiful way of explaining all this. So let's do a practice of meditation. Okay? Since the meditation is the medication, physical body needs to be prepared with only one asana, which is being described in Yoga Sutra. The asana is called Sthiram Sukham Asana. Sthiram is a stillness. I'm sitting in your kneeling chair. You can say I'm sitting on my kneeling chair. I am in a state of stillness. My body doesn't have this fasciculation. Fasciculation comes, when your muscle starts to relax. Before relaxation, this fasciculation starts. Stillness, sthiram, sukham, happy. I'm happy. I'm sitting down here all the time. I'm able to sit down as long as you want me to. I'm not uncomfortable. Asana, sthiram, sukham asanam is the pose I'm sitting down. Because I'm sitting down, I'm relaxed because my spine is straight, called Merudanda Achal, and my mind quiets down, so I'm on a state. So when you prepare your body with the sthiram, sukham asanam, then the muscles of respiration, which are called skeletal muscles. Skeletal muscles means muscles can be trained. So with the training of the skeletal muscles, your breathing becomes deeper and deeper and slower and slower. For example, my lung has a capacity of 6 liters. I need 1.5 liters to keep my lung open, and we only exchange 4.5 liters. We have 4.5 liters to exchange, but in a day-to-day practice, a tidal volume, we exchange only 500 cc, half a liter. So 80 to 90% of our lung capacity, we have a reserve. So breathe out first, empty your lung, slowly take a deep breath in, and when you take the breath in, you do effortlessly, as if it's a normal breathing. People ask me so many times, pranayama, if I don't have any proper guidance, I'm going to hurt myself. Yes, you're going to hurt yourself because you're going to push yourself. No, pushing, pulling, the effort in puffing, those are very good to build your strength and stamina. Hypoxia helps you with your strength and stamina. But for healing, you need the internal awareness. For the healing, you need able to do every pranayama as if it is your normal breathing. So when you able to sit down in sthiram sukhamasana, when your breathing becomes an effortless ease, see, dis-ease is a disease. Treatment is effortless ease. You enter into a state of meditation. Practice of meditation today, you're able to sit down with your spine straight. So here you are. So here I am. You can see I'm sitting in my kneeling stool. When I put my kneeling stool here, put my feet here, my spine remains straight. No way you can bend your spine, even if you don't have any support in the back. And Manasthi is quieting down mind. So it'll teach you how to quiet down your mind. So you can do all these things you can do. You can sit down, in a chair. Say, if you sit in a chair, you do the same thing. Sitting in a chair, what you will do, you'll be sitting in a chair and keep your body spine straight. As simple as it is. So when you keep your spine straight, you see, so if you sit in the front, and if you look from a profile, you will see my spine is straight. My body is at a right angle. So even if you go to the back of your chair, still keep your spine straight. The moment you have your spine straight, what happens? The muscles, the paraspinal muscles on the side of the spine, they start to become relaxed, and you become enter into a relaxation, a state. As simple as it is. So let's sit in a chair and we can do little meditation practice, and we'll tell you what are the practices you need to do. Most important therapeutic meditation practice is called a chakra balancing meditation. And we'll do the chakra balancing meditation. We'll guide you to asana, pranayama, mudras, bandhas, and the chanting sound. Now, the first asana, first meditation practice is you're able to control your five senses. Pratyahara, the fifth sense. So how to do it? Sitting in a spine straight, touch your index finger and a thumb. This is called your Dhyana Mudra or Jnana Mudra. Put it very nice and gently over your both the knees. And you have five senses. I hear, I see, I smell, I taste, and I touch. It's able to control your five senses. It is called, basically, we hear the name all the time, it's a guided meditation. Guided meditation means able to learn how to control your five senses. How to do it? The simplest way is eyes closed with your Dhyana Mudra. Visualize five objects around you. In the meantime, what will happen to you, your breathing is effortless, you have a parasympathetic activation, and if you look at me, I have a saliva in my mouth. I've been talking to you for so long, my mouth is not dry. Because when you have a parasympathetic activation, you get a activation of your salivary glands and saliva comes in your mouth. When you have a sympathetic overdrive, when you're afraid, mouth becomes dry. So I'm visualizing five objects. Breathing is effortless, breathing out longer than breathing in. Slows your breathing and makes your breathing deeper and deeper. Pick up four objects from there. Try to hear the sound of these four objects. I can clearly see all the four objects and hear the sound coming out of those four objects. Pick up three objects. Try to really appreciate the smell of those three objects. Pick up two objects. Try to have a taste of those two objects, how they will taste. Pick up one object and hold on to it. Hold on to it, stay holding, same way, keep your eyes closed and do it effortless breathing. So started with your vision with 5, started with your hearing 4, started with the smell 3 objects, taste 2 objects, and touch 1 object. Able to control your 5 senses. Guided meditation. Very, very important. Next thing is your focus meditation. Focus is you put a focus and keep your mind focused at that point. Most important focus meditation is breath-centered meditation. Your breath is going to guide you to enter into a state of meditation, and at the level of medication, your mind is going to produce all the medications which you are taking from outside. It can also be a visual image focusing. You can sit down, focus into a light of a candle or light of a diya, and keep focusing. Tratak. Or you're sitting down in front of an ocean, you're focusing your mind looking at that ocean, or you're looking at the tip of a mountain. Whatever the visual image you have, focus into it. You have a chanting meditation. You have a Om, you keep on chanting Om. Or you have a Pranava Pranayam. Pranava Pranayam is your Om, A, U, Ma, A, U, M. We'll do the Pranava Pranayam during our practice of chakra awakening meditation. Let's do a breath-centered meditation. Visualize your breath. Visualize your breath outside your nostril. Visualize the air is coming through your nostril. Air is coming through your nostril. Air is getting filtered. Your nose is a filter for your outside air. Nose is your also personal air conditioner. Outside air is warm, it will cool it down. When your outside air is cool, it will warm it up. It's all done through your regulating the blood flow in your nostril. Air goes on the side of your nose, which is called a turbinate. It's like a channel. It creates a vortex. The vortex goes over the mucus of your sinuses. Mucus of your sinuses secretes nitric oxide. Nitric oxide is a vasodilator. It opens a blood vessel and also an activator of your parasympathetic tone. There is a very recent publication showed the nasal breathing reduces your blood pressure because of the reduction of the afterload or reduction of your peripheral resistance, like a vasodilation effect. Parasympathetic activation is also done through acetylcholine, cyclic GMP, nitric oxide. Air is going to the back of your throat, coming to the upper part of the lung, middle part of the lung, lower part of the lung. It's almost to the level of your belly button. Here you have a little pause, a cable kumbhak. Do you feel it? That when you inhale, there's a pause and then start exhaling. Breathing out, air is coming in the lower part of the lung, middle part of the lung, upper part of the lung, behind your throat, coming through your nostril, coming out through your nose. Outside your nose, it picks up prana. Prana is a subtle energy which keeps us active, alive, and functional. Prana, teja, ojas. Prana is not your breath. Prana is like your electricity. Breath is like an electric cable, it's a carrier of the prana. This prana is called a pranic healing. In yogic tradition, our whole body does breathing, not only lung. The liver is breathing, kidney is breathing, our skin is breathing, brain is breathing. So our breath carries the prana to the organ of healing. For me, I have a heart problem. I see the prana is coming to my heart and it causing healing of my heart. It's called the pranic healing, pranic energizing technique. Somebody has a back pain, prana will go to your back. Who's a diabetes, prana is in the pancreas. We'll do pranic healing, which is essentially having an effect of the medication which you are taking. When you're in this state of focused meditation, you enter into the state, what is called entering into the subtle body. You have gross body, subtle body, and a causal body. Gross body is connected to a body, subtle body is to the mind, and causal body through your spirit. In a subtle body, which is the body of your mind, you have access to every part of your body without visualization. That means I am closing my eyes, I will be able to touch any part of my body. Also, interestingly, when I am doing this mudra, which is called a Dhyana mudra or Jnana mudra, now I can clearly feel the capillary pulsation of the blood vessels in the tip of my fingers. Also, I feel that there is a sort of little numbness. That means the nerve connections here, neurological connections, are slowly it is taming. Mudra is a connector, neurophysical connector. That means it connects your body and mind, so it quiets down your mind. See, accessing your causal body. My eyes are closed, I can touch tip of my nose, I can touch my left ear, I can touch back of my head, I can touch my left knee, I can touch my left little finger, so you can access any part of the body. And this focused meditation is a powerful tool which is called alternate nostril breathing without closing your nostril. Sit down with your Dhyana Mudra or Jnana Mudra with the spine straight, eyes closed. Visualize your left breath, left nose, left nostril. Breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. Initially, it may look like almost impossible, but with the practice, you'll be able to do. In fact, if you have a microphone, if I put a microphone on my left nostril, you'll see air is coming only through my left nostril, also right nostril. If your eyes closed, you're in a state of silence, and you continue that. Within a short time, you enter into a state of meditation, and you have no connection in the outside world. People always ask me, I'm doing a short-term meditation, so what is the effect of it? The effect of it that it continues through the rest of your day. It continues maybe throughout the whole day and night. You stay in a state of relaxed and calm, and you basically stay calm in the middle of a crisis. Your boss is upset with you, starts screaming and yelling at you, and he said it is his problem or her problem. He or she had a bad day. They may have a little argument with their spouses, or they have emotional garbage. And I'm their garbage dumpster. They're dumping their emotional garbage on me, so I stay calm in the middle of crisis. I don't react. Very important, this focused meditation. And when you do this focused meditation, you always entered, and when you do your monitoring of your cardiovascular function or neurological function, you stay in a state of parasympathetic state. Mindfulness meditation, that everything you are doing, you are connected with your mind. I'm talking to you, this is my meditation practice. I'm eating, that's my meditation practice. I'm reading a newspaper, that's my meditation practice. I'm cooking, that's my meditation practice. Anything you do with your mind in that proper function is your meditative practice. Movement is a meditation. You're walking, you are paying attention to your every breath. When you walk, you put the alternate foot. You don't put one foot. Put the right foot and the left foot, right foot and the left foot, because it balances you. Same way, if you're going up, if you're going to the steps, if you have a problem with your knees and hips and pains and everything, go slowly, hold into the rail, but don't do one foot at a time. Because so many people, my right foot, right foot, right foot, right foot, or left foot, left foot. No, right foot, the left foot, right, left. Even going down, I put the right foot first and the left going down, right, left, or left, right. Start with the non-dominant side. If I'm right-handed, I start with my left, because I need to activate my non-dominant side. Very important movement as a meditation. For the kapha people who are totally grounded, we do many times, it's called the Kati Chakra Asana. You put your hands in the front, you're standing up, but I'm in the chair, it's okay, fine. My eyes are closed. I visualize both of my hands. Breathe out first. Take a slow breathe in and slowly breathe out and turn my body all the way to the back, standing up or sitting down. In the same breathing out cycle, I come back in the middle again. My eyes are closed, I'm not seeing anything because my breath is my guide. Again here, breathe out first. Slowly breathe in. Breathe out and turn my waistline, Kati Chakra Asana. Movement as a meditation. We do a lot of relaxation practice. It's called your guided relaxation practice. One is called your instant relaxation technique. In instant relaxation technique, we generally do it in a floor, on our mat. We lay down. What we do, we will, forcefully contract all the muscles of our body and we let go. So it will be, you breathe out first. Take a deep breath in. Then contract your body, whole body. Then let your breath go. Breathe in, hold your breath, then contract your body, and then suddenly release. It's a wonderful relaxation technique. Instant relaxation technique, what we call a progressive relaxation. And the next one is called a quick relaxation technique. Same, you do down and you relax one part of the body a little bit of quickly. There is a deep relaxation technique. And deep relaxation technique, you start relaxing, first your toes, then your feet, then your leg muscles, thigh muscles, and ascending all the way up to your face, your shoulder, elbows, your hands, fingers. Is your progressive relaxation technique. We will be practicing your chakra awakening meditation, but let you know what are the other meditative practices. A powerful meditative practice is called your loving kindness practice. Being kind, being polite, and staying calm in the middle of crisis, or to be happy with what you have. Happy to be what you have is a loving kindness, and also it's your parasympathetic activation and gives you longevity. We have noticed the people who are living 90 years, 100 years, first and foremost thing they have, they're happy with what they have. It's a very, very important thing. They do not get uptight with the situation. Means, yes, here, I'm coming. Somebody, my brother is coming to my home. Okay, come on, sit down, sit next to me, eat what I am having, sleep with me. I'm happy with what I have with him. But the present day, oh, my brother is coming. Let me see where I can put him. Let me see if I have to fix this bed. Let's see if I have to clean this room. And that is a state of activation of your sympathetic tone. Playing with your grandchildren. Playing with your grandchildren is a parasympathetic activation. The reason is very simple. You don't have the responsibility and you are completely detached to let go. You spoil your grandkids and give it back to their parents. The parents are responsible for their children, not the grandchildren, not the grandparents. So grandparents playing with the grandkids is your meditative practice. Loving kindness practice. Spiritual practices. Every religion, established religion, or even a spiritual person who believes in humanity, who believes in staying in harmony with the nature, has a meditative practice. Islam has a 5 times they do their prayer, and the prayer, if you look at all the postures they go through, all the postures are very, very effective relaxation asanas. No, they'll sit down in a Vajrasana, like a thunderbolt. And Vajrasana is the most relaxing asanas. And when they're doing the spiritual practices, they're always in a state of meditative practice. And the basically the meditative practice is there is a lot of your chanting or sounds. It's the chanting is in every religion. And basically what the chanting is a vibration. Our body is in a state of vibration. When you create a vibration, 2 vibration interacts. It cancels each other. It's called a harmonic resonance. One of the powerful tools to practice chanting initially is your Bhramri Pranayam. The bumblebee. You close your eyes, shut down your 5 senses, then you breathe out the sound of a bumblebee. So the most therapeutic meditation is your chakra balancing meditation. The yogic anatomy, we have 3 bodies: gross body, sthula sharir, subtle body, sukha sharir, causal body, karana sharir. We have 5 sheets or layer around us called pancha koshas. First is a food sheath called Annamaya kosha. Around the Annamaya kosha is your physiological or functional breath called Pranamaya kosha. So if you have any imbalance in your physical body, it shows up in your breath. Your breath starts having a erratic breath. Around the breath is your mind, manomaya kosha. Your breath is interrupted. If your breath has an effort, it affects your mind. You become anxious, you become restless. Around the mind is your intellect, Vijnanamaya kosha. So when mind is at a restless, mind is not properly, your intellect is not properly functioning. Also, the content of your five senses is your mind, and those five senses, when they become more processed, they become your intellect, which is called a buddhi, which is your intellect. And beyond the intellect is your called Anandamaya kosha, or your blissful state. In Anandamaya kosha, all of your five senses, which becomes buddhi, your intellect, now become your wisdom. Anandamaya kosha. In the same anatomy, they have in yogic tradition, you have 7 chakras. The chakras are in the subtle body, they're not in the gross body. So if you start dissecting for the chakras in your physical body, you will never find it. Chakras are a concept because yogis felt that along the line of the spine there is an energy. And I'll say, suddenly they will get scared and say, looks like there is a snake has gone into my spine. They call them a kundalini. Kundalini is your serpentine, and the belief is that the whole potential spiritual energy is at the root of the spine, which can be awakened, and they travel along the spine to your top of your head, which is called a Sahasra chakra, and it becomes called a Kundalini Jagaran, waking up a potential energy at the root of the spine. The concept is there is a central channel which is called a Shushunmanari, and at the root there are 2 channels which crisscross your spine and then come out. One come out through left nostril called the Ida, which is calming, cooling, parasympathetic. Another come out the right nostril, which is called a Pingala, which is heating, analytical, sympathetic. And also they visualize the color. When they were in meditative practice, when they closed their eyes, they visualized the color in the nature. In the nature, they saw the color of your rainbows. And the sequence of color in the rainbows are called Vibji, or violet, indigo blue, green, yellow, orange, red. And they have assigned the 7 chakras, the 7 colors of your rainbow in the order of starting violet in the top and ending in the red in the bottom, called Muladhara chakra. Every chakra they described as a physical, like a lotus which is in imbalance and which is dormant, which is not awakened. And they are in the strategic position, on the head, called a Sahasra chakra, crown chakra. Between your 2 eyes is called a Agga chakra. At the throat level is your called a Vishuddha chakra. At the heart level, Anahata chakra. At a belly button level is your Manipur chakra or solar plexus chakra. Between your belly button and the root of the spine is called Shadhisthana chakra or a pelvic chakra, and the root of the spine is called your Muladhara chakra or root chakra. Now let me go over with you the physical characters of these chakras, the function of these chakras, the connection of the chakras with your nervous system, connection of the chakras with your endocrine system, and the practices which are your asana poses, pranayama, mudras and bandhas, and your chanting sound to balance these chakras. So let's start first with a Muladhara chakra, the root chakra. Root chakra is in the base of your spine. Red in color, it has 4 petals and they are dormant. It connected to musculoskeletal system. Function is the power. These are your, we call it animal instinct, the power. It is connected to your, say, endocrine organs like adrenal glands, which gives you all the power and all the hormones, adrenal glands, and is connected to sacral plexus. The asanas to balance, which should be grounding asanas, like your lotus pose, Padmasana, or your butterfly, Titli asana. Pranayama should be your Kapalbhati pranayama, because it's going to massage the root chakra. Mudras will be, because of power, Shakti mudra, touching your little finger, ring finger and thumb, Shakti mudra. And then your bandhas will be your root lock, Muladhara bandha. So we'll be practicing with the mudras and the sound, but before that let's explain the chakras, because you will be doing the practices based on the system which you have a disease. Between the belly button and the root of the spine is your Shadhisthana chakra, or a pelvic chakra. Pelvic chakra is, so it's a sequence of your rainbow. So orange, color is orange, 6 petals connected to your reproductive system. So any problem with your reproductive system, you do a balance this chakra. Connected to your gonads from endocrine system, like ovaries and testicles, and are connected to your pelvic plexus. The asanas, which are the number 1 asana, is called a Brahmachari asana. Brahmachari asana, basically called a celibacy asana. It is like sitting like your Vajrasana, like your thunderbolt pose, but your feet turn, other way. And also it is, activating in your pelvic area, Malasana, like a squatting pose. Pranayama, again, massaging here is a Kapalbhati pranayama. And these are also connected to your elements, 5 elements. The lower one, the Muladhara chakra, which is connected to musculoskeletal system, element of an earth. And this is the pelvic chakra is connected to your water. So mudra will be your Varun mudra, touching the fire component and the water component. And your bandha will be again your Muladhara bandha, root lock. And the sound, the first one sound to balance was a lam, and this one is a vam. And you'll see all the sounds, the 7 chakras sounds to wake up, and so it's the ma. Lam, vam, ram, yam, ham, sham, om. Third one is your Manipur chakra, the level of your belly button, connected to your gastrointestinal system. So any gastrointestinal issue, you balance this chakra. Color is yellow. 10 petals, connected to solar plexus. Endocrine gland connects to the pancreas and the beta cells. Basically, it's the area for the diabetes. Function, the lower one is the power, the second one is your procreation. Power, procreation, this is the function, is a control. Muladhara chakra. Asanas to balance, asanas will be sitting down like your say, Bakrasan, the spinal twist, Bakrasan, or Nokasan, here, Nokasan. So anything related to your belly button. Pranayama will be Bajra Pranayam, breath holding and exhalation. Breathe out first, take a deep breath in, breathe out, suck your stomach in and hold. Bajra Pranayam. We do practice, we do practice all the time. But we cannot practice all at the same time. So we'll be doing practicing your chanting. It's a fire element. So mudras will be your Pachan mudra, or digestion mudra, Pachan mudra. And your bandhas will be your Udyani bandh, abdominal lock. And sound, lam, vam, ram. Sound will be the ram. Heart chakra. So all 3 word chakras, we call it animal instinct. These are basic survival chakras. Heart chakra now is a love. It is a connector between the 3 spiritual chakras and the 3 we call it a grounding chakras. And heart, at the level of your heart, Anahata chakra, heart chakra, color is green. It is 12 petals connected to cardiovascular system. Function is love. Connected to cardiac plexus, and endocrine connected to thymus gland. Asanas to open chest opening poses. So, say cobra pose, Bhujangasana, or a prayer pose to the back, your Paschim Namaskar. Pranayama will be alternate nostril breathing, because it will be the air element. Remember, the earth, water, fire, now is the air element. In the air element, you will have a Shunya Mudra. So mudra will be index finger down, this will be Shunya Mudra. Good practice. And bandhas, again, will be your Udyani bandh, because it's the Kundalini Jagaran, like your chakras are ascending. Wonderful way of explaining and practicing. And sound here is yam to balance these chakras. Next, the Vishuddha chakra at the level of your throat. It is for communication. Color is blue. 16 petals connected to your respiratory system. Endocrine, it connects to your thyroid and parathyroid gland. And nervous plexus, it's connected to your pharyngeal plexus. So the asanas to balance is your Brahma Mudra. Brahma Mudra is your rotating your neck in all 4 positions, front and back, side to side, looking in the back and the rotation, Brahma Mudra. And also, like say here in the in the throat, you can do Ustrasana. It's a camel pose. When you camel pose, pranayama, you do the pranayama here because of the pharynx and connection is a Ujjayi pranayama. When you get a cough with Ujjayi pranayama, is a normal practice. I mean, we have all the practices. I'm going over with you with each chakra, so understand how to balance all these chakras. Ujjayi pranayama will balance your throat chakra. So any respiratory issue, you'll be practicing your Ujjayi pranayama. So it's a space element now. It's a space element. So your mudra will be your Shunya mudra, touching middle finger and thumb, because the middle finger represents your space element. And your bandhas will be your Jalandhar bandha or your chin lock. And the sound here is yam hum. When you get a hum, you balance this chakra. 6th chakra is Agna chakra, in between your 2 eyes, third eye. Color is indigo, and it has 2 petals connected with the pituitary gland for your endocrine, and nervous is connected to the vagus nerve and parasympathetic activation. So able to balance this chakra is your parasympathetic activation. Function is the intuition, it is very intuitive. The asanas to balance the chakra is a balasana, like a child's pose, or a shashanka asana, like a rabbit pose. You also can do a, say, shoulder stand, plow, but mostly touching the forehead. Pranayama is going to be Om Pranayama. Mudra will be Dhyana Mudra or a Jnana Mudra. And Bandha will be your Jalandhar Bandha, the chin lock. Sahasra Chakra, its color is violet, 1000 petals connected to your nervous system. Especially we call it supratentorial, above, close to your limbic system. Endocrine connected to the pineal gland. Function is a blissful state. Asana is your Shirshasana, headstand. Pranayama is a Pranabha pranayama. A, U, Ma with your chin mudra, Chinmay mudra and Adhi mudra. Pranabha pranayama. Mudras again in Dhyana mudra or Jnana mudra. And Bandha is your chin lock, Jalandhar Bandha. So once you understand this, the 7 color musculoskeletal system, your gynecological, not gynecological, I'm saying the whole, your testicle, ovary, the reproductive system, musculoskeletal system, reproductive system, gastrointestinal system, cardiovascular system, respiratory system, endocrine system, neurological system, especially in neuropsychiatric disorders in the limbic system. So the simple practice is, first, sit down again with the spine straight, eyes closed. The first asana, first mudra will be your Shakti mudra. Sound will be here, Lam. So close our eyes, breathe out first, take a deep breath in, sound is the sound of Lam. We're not going to talk to about any other things, we're just going to practice the sound with the mudra. Shakti mudra. Lam. Second, Shadhisthana chakra. So, water element, Varun mudra, sound is Vam. Vam. Panchan mudra for the fire element, solar plexus chakra, Manipur chakra, sound is Ram. Ram. Anahata chakra or heart chakra is your Vayu mudra. Put the index finger down, and the sound here is Yam. So put your focus at the level of your heart. Yam. Bring your attention to your throat chakra. The element is the space, so it is Shunda mudra. And sound here is Hum. Hum. Bring your attention to your third eye in between your eyebrows. Agda chakra. Dhyana mudra, Jnana mudra. Sound here is sham, S-H, sham. Sham. Bring your awareness to the crown. Again, the mudra is your Dhyana mudra or Jnana mudra, and the sound here is your Om. Lam, Vam, Ram, Yam, Hum, Sham, Om. Om has a three component, A, U, Ma. A comes from the lower part of the lung, U comes from the middle part of the lung, and Ma comes from the upper part of the lung. Put your hand together in front of you. Touch the little finger and thumb. Separate your fingers. Padma Mudra. Lotus Mudra connects your body, mind and spirit. Slowly bring the Lotus Mudra close to your heart. Heart is the site of your soul. We have a brain-heart connection. We literally use the word called memorized by heart. It's a wonderful expression. So this meditative practice, it's your physical wellness, mental wellness, and spiritual wellness. This meditative practice is basically a parasympathetic activation with a saliva in your mouth. The moment you have a saliva in your mouth throughout the whole day and you maintain a daily routine, dinacharya, with your food balance and water balance, with the quantity and timing, you stay calm in the middle of crisis, and you have a good quality living for extended period of time. This is free, medication free, and enjoying a good quality living. Hands together in front of your heart chakra, bow your head down, you say namaste. Namaste is, I honor the divinity within you, you are divine, and we are connected with our divinity and spiritual experience. Once we are connected, the word spirit came from the root word spiritus. Spiritus is breath. We're all connected through our breath. So wonderful practice. Meditation is medication, and again and again emphasizing, this is free, disease-free, medication-free, enjoying a good quality life and living. Thank you for joining. It may be a little bit of a longer class, but have this recording. It will be up in your YouTube channel soon, and take a look at it, practice it, and become the part of a meditative practice. Again, meditation doesn't come just sitting down and I'm meditating. You have to practice with your physical body and breath. Thank you again for listening. We'll come back again in next Saturday if I'm in town. I may be out of town one of these Saturdays, but I'll let you know when. Okay? Thank you. Bye-bye.